Can you see now?
Yes, sir.
So we can see, sir.
Okay. I bring greetings from ILBS and is this okay? Am I audible?
Yes, sir. Yes, sir. Very good. Continue, sir.
I have no conflict of interest except that we have very bright faculty and very bright residents. For third year in a row, ILBS was ranked second by UGC after AIMS Delhi in scholastic output and research. So I'm going to show you a few cases, and I wish I could prepare it better, but let's start. 55-year chronic hepatitis C cirrhosis was put on DAA. SVR was achieved at 6 months. 1 month later, the patient had prodrome icterus, 2 weeks. Bilirubin went up, ALT high, INR 2.5. Any diagnosis? You can put it on the chat box. I'm not going to ask very senior people who are on the panel, but here is a Hep C patient, and these are live cases. This was from, I think, Patiala. This patient was from Patiala. Well, I don't know what the chat box says. I'm moving forward. I have somebody in chat box now. So how do you get it? All right. So the interesting part of this patient was this patient was found to be HbSAg positive. This patient was HbSAg negative before start of therapy. After HCV therapy was completed, 7th month, he is found now with surface positive, E positive, IgM positive. And therefore, the diagnosis is reactivation of hepatitis B following completion and viral clearance of Hep C. These are not uncommon. I would easily recount more than 24 such cases. At least 2 I remember those who died. So please remember, you have to do an anti-HBC total before starting therapy, not just HbSAg, because this patient was HbSAg negative, but IgG anticore positive, and was started antiviral in Punjab. And when he came to us, he had RNA became negative, but he was full-blown hepatitis B. Well, the patient survived. The question is this patient having acute liver failure, which it is like this, liver failure, INR is high, bilirubin is high, or this is reactivation of hepatitis B post DAA. All other causes were excluded in this patient. We'll come to this again. Just to remind you, and this is the core, this is the spine of reactivation diagnosis. In reactivation, your DNA is more than 20,000 international unit. So please, you may not do HbSAg may be negative. There are at least 5-7 patients who are HbSAg negative, but DNA became positive. And I'm sure the panelists will ask questions on this. So the bottom line is, the spine is that DNA levels are high, and therefore you start treating like chronic B and treat. Now, this should have been case 2. This is a live case, maybe 5-6 days. The patient is still in the hospital. 33-year male, he is a resident of UP, no addiction. He had jaundice of 1 week and no other complaints, and there was a prodrome. He has no other history except he was diagnosed as Hep B in 2011. He was taking TAF, but he stopped taking antiviral for 3 months after this pandemic and did not get the drug. So now he was on drug therapy for almost 9 years, but now he stopped it. There is no other family history. Nothing in examination. There was no ascites. He just had a spleen which was palpable and liver was enlarged. Now, this is his labs 2011, then in 2016, 17, 18. Now, see that he was on therapy, but his DNA started coming up. In 19, he still had DNA, which is 3 log. But now he stopped therapy. Now, this is yesterday, 8:10. He has a INR, which is 1.1. His bill is 9.5, and his enzymes are 2600. AST is higher than ALT. I would have thought he got some dilly, but here it is the way it is. And the DNA, which was log 3 in 2019, has now become log 6, means it is in millions. So, as a routine, every such patient, we would do a liver biopsy. But before that, HbSAg, E antigen, both were positive. Anti-E is negative. And he has an anti-core, IgM, positive. Nothing else. This is the biopsy. Now, the biopsy with mesenteric will show you there is at least a bridging fibrosis. So, it is stage 2. You will also see there is some hepatitis which is due to fat, but not much. But what is this? Again, this can be in the chat box. Anybody who can say what it is like? Of course, next slide will show you. But this is to show and ask you what it is like. All right. So now you can see ground glass hepatocytes in the low power, and you can also see several ground glass hepatocytes. It's like a flag, but these are all ground glass hepatocytes. And there is cholestasis, which is seen in this patient. Here again, ground glass hepatocytes. Now, what does the ground glass hepatocyte and reactivation to do together? Reactivation should have cleared everything, but we got this guy within 7 days. So before his cells, which have hepatitis B, will start dying, maybe in 2 weeks' time, this guy will have a bilirubin of 30. But right now he is with us and he is on therapy, fortunately. You can also see there is lot of inflammatory this thing. And this is again